Good afternoon, everyone. Welcome to this month's Durham Opioid Settlement Advisory Committee meeting. My name is Shalisa Howard Martinez. I am a co-chair of the committee, and I serve on the community-based organization seat as a representative. We're going to go ahead and get started with our meeting, even though we still are missing a few committee members for quorum. So our first bit of activity today is just to have the committee members who are here currently, if we could all go around and just introduce yourselves, and then we'll get started with an agenda review. So I'm going to pass it to Brittany.
Hi, I'm Brittany Price. I'm in the healthcare payer funder seat, and I am also a co-chair. And I'll pass it to Commissioner Jacobs.
Hi, everyone. Hope everyone had a good summer break. I'm Wendy Jacobs, Durham County Commissioner, filling the elected official seat. And I'll pass it to Jamie Carter.
Jamie, I'm not sure if she's here yet, or maybe she's on mute. So let's pass it to Attorney Baxton, to Dawn.
Good afternoon. I'm Dawn Baxton, Public Defender for Durham County. And I will pass it to Kristen.
Good afternoon, everyone. I'm Kristen Patterson, one of the Assistant Health Directors here for Durham County, and I will pass it to Paul.
Hi everybody. Am I on? I can't quite tell.
Yes.
Okay. Good. I just got admitted, so sorry to be late. But are we doing introductions? Is that what we're doing, Shalisa?
Yes.
Okay. So Paul Nagy, retired but kind of got rehired by Duke Department of Psychiatry. Licensed clinical counselor, licensed clinical addiction specialist.
Okay. Paul, can you pass it to someone else? I think
I
Jamie maybe.
can't see anybody.
Okay.
I'm just seeing you. I was going
Okay.
to say fortunately or unfortunately. I didn't want to say
I
unfortunately.
can go.
Yeah, Jamie can go now. Go ahead, Jamie.
Hey, Jamie Carter. I'm an addiction medicine doctor at Lincoln Community Health Center. I'm in the healthcare provider seat. Is that everybody?
I believe that's it for committee members. But let's go ahead and keep going. And then when a member joins, we can ask them to introduce themselves. So, um, the purpose of the Opioid Settlement Advisory Committee, our purpose is to review and recommend funding proposals and strategic initiatives to the Durham County Board of County Commissioners that align with the requirements of the Opioid Settlements Memorandum of Agreement between the state of North Carolina and the local governments on proceeds related to the settlement of opioid litigation. And we also help inform funding priorities. We assess program effectiveness, ensure decisions are grounded in community needs and evidence-based strategies. And this part around program effectiveness is going to be a part of our discussion tonight as far as the upcoming presentations from this year's grantees. Just wanted to start off the meeting with just, again, us remembering what our overall purpose is as an advisory committee. So now after we've done the meeting call to order, we're just going to now do a quick round of announcements. I have a few to share, and then after I'm finished, we can just open the floor for whomever else has something they want to share. So the first is on September 8th, there will be a tour of Healing Transitions Women's Campus in Raleigh. This tour is from 11 a.m. to 1 p.m. Everyone who is a part of the committee is welcome to join the tour. If you are interested in doing this after today's meeting, I will send a link to the calendar invitation. You can add your name to indicate that you would like to join. And I also will include the person who's kind of coordinating this meeting for Durham County. She's with the County Department of Public Health. We've also been invited by the Promise Resources Network to visit their peer respite house in Raleigh this fall. We received this invitation after a suggestion from a community member back in July, David Crispell with Jubilee House, excuse me. And we had some continued conversation with some folks from the respite house, and they suggested that through Thursdays are probably the best days for us to do a visit, and that the last week of October is just not a good time for them, but we need to have a week's notice just to make sure that they have time just to let their guests know that they'll be visitors. So I just wanted to find out today from the committee, is there interest in doing a field trip? This is an example of a community-based organization, community-based program that may be just interesting and for us to know, to learn more about this model. So just wanted just to find out today if anyone would be interested. And I see Commissioner Jacobs has raised her hand. So go ahead, Commissioner Jacobs.
Yeah, so first of all, I'm sorry I'm going to miss the Healing Transitions visit. We actually have a work session that day because the 7th is that Monday is the Labor Day holiday. So yeah, I encourage anyone who can go. I think it was one of our Durham Joins Together meetings. We had somebody come from Healing Transitions to speak, and it was virtual, and so it was actually what they're doing there is amazing, and we can definitely learn from that. And then the respite home, I think, is really important for Durham to also see because we don't have anything like that also in Durham County. And it's my understanding that that is being funded through Alliance. So I think we do have an opportunity to try to replicate that model here in Durham. So I would suggest that we maybe look at a date in October, like poll people, those, Tuesday, Wednesday, Thursday dates. And I'm assuming, yeah, and I don't know what time of day would be best for people. Like, can it be, I think that's the other issue is like, what is the time of day for them that would be best to find that out? So, because people are working, but maybe in order to go there, we do have to stick to their schedule,
Yeah.
rather than after 5 o'clock or whatever. So that would be helpful to know as well. But thank you for helping to coordinate this. And the other suggestion I have is I think I asked about how many people would be okay, but because we could also open this up to Durham Joins Together as well, if we can have, I don't know, a larger group of people. So thank you.
Thank you. Is there interest from any of the other members of having this site visit to the respite house in Raleigh? And what I could do is, if there is, we can do like I don't have a problem with doing the next steps as far as like finding out a best time, setting up a poll, finding out if it's okay to invite more folks, like members from Durham Joins Together. So, how do other members feel about this opportunity?
I'd certainly be open and interested. I guess I'm wondering the definition of a respite home. I'm not real clear what that really is. Do we know? Like what do they do exactly?
Yeah. Go ahead, Commissioner Jacobs. I saw you raise your hand immediately.
Yeah. But my understanding, there was an article about it in the Indy actually last year, is that it's kind of like a safe place that people can go. It's something, it's basically a house that people can come to when they are feeling like they're in crisis, whether it's related to mental health or substance use. And they can go there and, it's almost, I got the feeling that it serves a more of almost like a preventative role, like when people are starting to feel like they need help, they can go there. And it seems like it's been having really effective results in helping people, and instead of waiting till people are really in crisis and they end up like in the recovery response center, or as compared to like transitional housing. It's like filling a need in the system that, again, we don't have anything like that in Durham.
Yeah, and it's from what I understand, they have a cafe, community space, and it's run by people who have experience with drug use or mental health challenges or things like that. Yeah, issues like that.
So it's a I guess for lack of a better term, an outpatient place to come and be supported, like a walk-in if somebody, to Wendy's point, is
Yeah, but it's non-medical from what I understand as well. As I'm not
okay.
sure, but that's from my reading. But
But it's not they
so,
call it a house, so I didn't know if that meant
mhm.
an overnight stay involved. Like, do they
It's
house homeless people, or is it more just a place to come and take a breath and get some support?
Hmm.
I thought that it was a that there was a place that it was a place to stay, but I can look it up real quick.
I think it
I
looked like
know
a 10-day stay for
Just
Yeah,
10 day?
people
Okay.
at a time.
yeah,
like a short-term stay, maybe. I know
yeah,
there's one in Raleigh, and the same group also operates or has one in Charlotte as well. And I think
yeah,
those are the only two locations in North Carolina.
yeah. It's a it is there's the option for this stay.
Yeah. So it
Yeah, I
seems like
think it
there's
sounds interesting for sure to learn more about. And yeah, I mean it may be challenging to coordinate with people's schedules and their schedule. So I
Mhm.
mean I'd also be open to just like getting a presentation from them, but it would be great if we could all.
Okay. All right. So what I'll do is I will reach it back out and find out about the time of day, how many people can visit, and then we'll move from there with a poll. And then also, if we're not able to get a visit going this fall, I think the idea that you had, Jamie, about maybe a future presentation can also be a possibility as well. So, okay. Hey, thank y'all. Any other announcements? Okay. So next what we're going to do is we're going to review and approve the meeting minutes from our June meeting. We also are going to take some time to look at the self-assessment results that the committee members completed back in July, and we'll have a short debrief of those results. And then we're going to get into defining like what are our desired outcomes for the grantee presentations that are coming up in October. And then we'll hopefully wrap up before 6:30 with just identifying additional agenda items for September. So I'm going to go ahead and I'm just going to show our meeting minutes from June. I'll make this a little bit bigger and then I'll give everyone like a few minutes just to look at them and then we can open the floor for corrections or questions. I want to welcome Lofton to the meeting. Lofton, would you can you please introduce yourself?
Yes, sorry I'm joining late.
Okay.
I'm out on outreach right now, so I'm gonna be like as present as I can be. I'm Lofton. I work for the North Carolina Harm Reduction Coalition, and I'm in the person with lived experience chair on the committee, and I'm happy to be here.
Thank you. See you. Any questions or corrections needed for the June meeting minutes? Go ahead, Commissioner Jacobs.
I just want to say thank you. Jason, did you write these minutes? Who did the minutes?
Jason?
Yes, ma'am.
Thank you. These are incredibly detailed minutes. Thank you so much. I really appreciate it.
Any correction?
I was gonna echo that. I thought they were great. So, and they look, from what I can remember from June, it's hard to remember yesterday, but it looked very, very accurate to me. So I'll make a motion to accept the minutes.
Okay.
Second.
Someone second? Okay. And then we're going to go ahead and vote. All in favor of accepting the June 2026 meeting minutes, please say aye.
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 Right?
Aye.
Anyone opposed? Okay. So the minutes have been approved. Next, we're going to look at the debrief. We'll have a very quick debrief about our self-assessment that the members completed back again in July. And this assessment was completed by all 9 members. And Jason has compiled the responses and shared the document with us ahead of the meeting today. And we just wanted to have like a quick debrief to find out, are there questions? Are there points of from this report that you would like to discuss, or you like to highlight for the committee to consider for more discussion, maybe down the line? But I'll just put the document up for a minute and then we can just open it up for comments. Any questions, comments around our summary report?
No, I was just going to make the comment that I appreciated the opportunity to participate in it. I thought, it was timely, and I thought it was a good idea to do it, particularly, in our first year.
Mhm. Right, go to that. Thank you, Paul. And yes, we still are, Jason is still working to get some responses to us from the Durham County Commissioners about some of the questions that we had back at during this June debrief. Our last meeting, we had our debrief of the previous years or the next year's funding recommendations. And so we're still waiting to hear more guidance from the county commissioners. Um, Anything else anyone wants to add or just share about the self-assessment? Okay. So thank you all. So we're going to go ahead and begin our work today of figuring out a process for the grantee presentations, which are in October. At our last meeting in June, our learning priorities, well, the calendar of learning priorities, when we would invite in guest speakers to share more information about specific topics, is changed a little bit. So back in June, we had anticipated having representatives from Durham joins together the 3 committees and their co-chairs with us today, but that did not work out because of vacation plans and things like that. So we're hoping to have them here in September. And so that's the reason why we've done some shifting. And today we're going to focus on defining our process for the FY 2027 grantee presentations, which are scheduled to happen in October. So we hope to have Durham joins together next month with us. In November, we'll invite the treatment providers and Alliance Health. December, harm reduction, the City of Durham's Community Safety Department, which includes the Heart and Hope team. And then in January, we would like to have the Justice Services Department representatives from their different programs join us here. And then what I'm proposing is the other topic that kind of has been adjusted as far as the timeline is around the successful practices and lessons learned from other communities. I'm suggesting that we wait until February to have that topic be the focus of the meeting. I just wanted to find out if this would be okay for us or for to y'all for this evening, knowing that of course things may change based off of like the guest speakers' availability. Um, how do people feel about this new learning calendar? The sequence of topics and guest speakers.
I think it looks great.
All right. Is anyone concerned or feel like, maybe something, maybe a topic should be, the sequence maybe should be adjusted? Go ahead, Dawn.
I personally would like to have successful practices or lessons learned from other communities sooner rather than later.
Okay. Which month would you like to suggest as far as that happening?
Um, September or October,
September, October.
sometime well before we start our 2027 grant process. I think it will be good to see or learn something from others.
Okay. So Jason, I wanted to ask in October, that is definite. We have the presentations have been scheduled for October. Is there any room to move that around or
Yeah, there is room to move it around. I haven't confirmed, just due to there being, I believe, close to 8 or 9 presentation, which is triple from last year. So
mhm.
definitely flexible and you know, it's really at your disposal to where however you guys want to fit that in.
Okay.
And then I saw in the chat that Commissioner Jacobs suggested that we invite Nitty back to talk about best practices because she's overseeing all of the county programs in North
Mhm.
Carolina, which I think is a wonderful idea.
Yeah. Um, and let's see, who else? Did someone else raise their hand while you were Commissioner Jacobs? Yeah.
Yeah, well, Dawn, I understand you're wanting to hear about best practices, but I don't know. It seems to me to make sense that we first hear from the programs that we're currently funding, even if it's just briefly, and then hear about best practices so that we can at least have a foundation in knowing what all of the other, um, what all the, what other counties are doing to at least have that conversation grounded in what we're doing. I do also think it's important we hear from Durham Joints Together before that as well, because that's these are folks that have been doing stuff for a long time in the community. So that's my suggestion. I don't know how, looking at the timeline, when would be the earliest we could hear from Nitty? If we hear from all the existing programs first, Jason or Shalisa, what does that look like?
Well, I think the grantee presentations, that's what we're going to try to figure out tonight as far as the process for that.
Okay.
What Jason just said is just that there is some flexibility to have them come at a different time than October. Is that correct, Jason?
Yeah, yeah, that's definitely correct. Typically we do October because that gives everyone at least the first quarter to be able to kind of, get the grounding underneath of them. So yeah, it can be moved. October typically
Okay.
serves me well, but it can be moved. And once again, there's 9, I believe, 8 or 9
Yeah.
different presentations. So, you know, uh, worth the discussion for tonight. So
Yeah.
Okay.
So you know
Okay.
what we how about go ahead, Jamie.
Yeah, just wondering, maybe I'm off on the timeline, but like, so we would be hearing from the people who we reviewed their applications in this spring, and then the funding was approved, and then their funding kind of started like this summer, and then we would be
Yes.
hearing about it in October. Yeah, I mean, to me, like that seems kind of early to hear really any outcomes of their work, and I feel like we're already sort of familiar with the concept of their work, so I do wonder if that could be pushed some to give them more time to like actually do work, collect data. I don't know how much they're going to have to report that just like 3 or 4 months into the cycle. So maybe I don't know if that could be an opportunity to adjust and hear from other communities earlier or just move things around a bit.
Mm-hmm. So I'm hearing Durham joins together September, but perhaps in October or maybe even November, we can have successful practices or lessons learned from other communities and also invite Nitty to come in and then have the grantee presentations follow those two. Is that what I'm hearing from y'all? Okay. Go ahead, Dawn. Yep.
Yeah, I wanted to clarify about hearing about successful practices and lessons learned from other communities. I
Mhm.
know the person who's overseeing all of the committees, but I would like to hear from other members who are actually on the committee from other counties to see what they personally think has worked well um, for their opioid settlement committee.
hmm So, and you're saying for the speaker, we would like to have the committee members and not like the program manager
Right.
speak with us. Okay. And what about October for that topic?
I mean, well, if the group is set on or insisting on having Durham joins in September, and if that's the earliest that we can have them, then that would be great.
Okay. So September, I'm just going to just repeat this for everyone and then we'll figure out, does everyone agree with this suggestion? September Durham joins together because we have been wanting to hear from them for a while. October, we would hear from committee members from other counties about their experience with this process. What have they learned? What's worked? In October, we can invite the grantees, or we could either go ahead and invite the treatment providers and Alliance Health, and maybe begin inviting the grantees in November. And then from there, just continue the sequence, in um, December, then it would be the harm reduction folks, January, Durham Justice Services Department in February. We could maybe go back and see who else is missing. And also we have to work in the NC core group. But I'm hearing September, Durham joins together, in October, folks from other communities who serve on the OSAC committee for their county. Okay.
I wonder if um I do think it's a good idea to hear from folks in other counties. I wonder if we could still hear a little from Nitty at that
Mm-hmm.
same meeting.
Yeah. And which specific counties are y'all interested in hearing from? Because I remember when we had this discussion before, we wanted to make sure that it was a similar county as far as demographics to Durham, so like one of our peer counties. And I think there's like, 4 or 5 counties that are considered peers of Durham. So I know Guilford is one. Um, I'm completely blanked on the other one, but I know Guilford is one of our peer counties. But what would be another county that y'all would be interested in hearing from? Forsyth. That's, I think, also commonly considered a peer county of Durham. See here. So Brittany says a little bit complicated because her understanding is that each county does not have a committee like ours. Okay. So Wendy says we benchmark ourselves with Cumberland, Mecklenburg, Wake, and Guilford. So, Jason, looking at that list of counties that are considered peer counties, um, do they have similar committees as this one? And would you be, if so, would you be willing to reach out um to invite representatives from, I don't know, at least all of them to find out who's available, first of all, but do Guilford, Cumberland, Mecklenburg, and Wake, do they have similar county or committees?
So all their committees, they are very different, and for different reasons. Guilford is a consolidated health department, so they have a human health services advisory committee. Their situation is slightly different, how their setup is, and I do have contacts for each one of these. Mecklenburg, their advisory committee is run through. It's a very different infrastructure. It's not
Yeah.
like ours at all, and so. They have a completely different setup, which I'm sure Marcus could speak to. Wake County has a lot of different municipalities. That's obviously you guys all probably know Alyssa Kitlis, good friend of all of ours.
Yeah.
And Wake obviously has quite a different funding infrastructure that's different than ours. Also,
Mhm.
their team in capacity looks a little bit different, and I think Alyssa can speak to that. And Cumberland as well. So I'm not
Mhm.
too connected with Cumberland as much, but I do have their contact as well. So more than glad to get these all online if needed.
How do y'all feel about that? Like, Jason reaching out to these folks, even though they may be different as far as how their committees are structured, the funding. Um, it sounds like to me, even I'll just suggest this. I wonder if we should ask Nitty about this, since she is the person who is working like at the state level, which are the counties that are most similarly structured as ours, and maybe that's the place to start. Okay. So what I'm proposing, and we could just do a quick room check, is this September, Durham joins together. Between now and September, we'll reach out to find out what are similar counties that have similar structures and similar demographics as Durham. It may be the four that Commissioner Jacobs shared, and maybe others that we're not aware of. In October, hopefully by that time, we've identified and invited some folks from those communities who are representing OSAC to come and speak with us in October. And then in November, we can begin having the grantee presentations. In December, the treatment providers. January, harm reduction and the City of Durham's Community Safety Department. And then in February, we can invite in the Justice Services Department. And I wonder if we could ask Nitty also to maybe join for the October meeting as well. Maybe it could be like she can do an overview, and then we can have the county representatives share what they've learned, what they're doing. How does that sound to everyone?
Yeah, I think it would be maybe a good idea to have um before or like when we invite folks to have like a set of questions, sort of like how we what we came up
Mm-hmm.
with
Mm-hmm.
for these other presentations, to try to orient, because as much as like, it is interesting what another county is doing with their funds, but it might behoove us, and what I think I'm hearing from Dawn is like, or like orienting toward like what processes have worked well for them.
Mm-hmm.
Is all right, Dawn.
Yes, I'm interested. What processes have worked well? What
Mm-hmm.
other things have they found in the once we identify the ones that are similar to us that have been well to fund from the funds
Mm-hmm.
to get a different view.
Okay. And what we could do is we can also start a list. I can send out a list after this meeting where we can start collecting those questions, and I can bring them back. we could bring him back in September and look at him again in preparation for the October presentations. Because we do have a set of questions for the guest speakers from Durham, but we don't have one for that category. So we'll just begin a list and work on it next month and then be prepared for October. How does that sound? All right. Any other thoughts or questions around this calendar? Yeah, go ahead, Commissioner Jacobs.
Just wondering when thinking about, the timeline, and Jason, maybe you can help us with this. When we do need to think about like the process of when the actual RFPs are going to go out, or I guess, Jason, just to clarify, I think we talked about this before. Is the current funding going to last actually more than 1 year so that we don't do the RFP process again for another year? Or what, could you clarify that? I'm just thinking about in terms of the county budget because people start working on the budget actually like right after the new year, even. So could you just talk about that in terms of the funding process, Jason, and how that might fit into the schedule that Shalice is talking about?
Yeah, absolutely. I think to answer your first question, Commissioner Jacobs, is actually going to be one that I would have to actually defer to Keith Lane, our budget director, as they're monitoring both our budget and also our finance team as well. And just also everyone is aware that we have, I believe, already settled in. Yes, we've already settled on a different agreement, which will have a slight increase in our current funding amounts. And so the infamous payment schedule that you guys have seen before, that will eventually change. And I think when Nitty comes on, she'll be able to share more of that around that regard. And so with that being said, I don't think it's a huge increase in that regard. But I do know that this increase was very temporary. I know we brought this to the county budget team initially. There was kind of a hard stop around this. I know it's going to be good for at least 1 year. I'm not sure if there is an option to renew. If you look back at the RFP, which I'm sure no one probably looked back at it, but there is an option to renew it if there was a budget allowance around that. But I'm not 100% sure. Those are conversations that we would have to have with Keith and David in the budget office in that regard, and also finance as well. And so something that I'm working towards early with now. I've actually been working with Shannon around these regards, trying to get stuff set up for this current fiscal year. So it's really hard to say at this point in time as we're trying to square away this fiscal year and closing out last fiscal year as well. So there's a lot of things that are pending at this point. And so, Kristen, I don't know if I missed anything that you probably could add, but I think that's pretty much all the information that I know at this point, Commissioner Jacobs.
Okay, well, I think it would be helpful to know what the timeline will be for the opioid funding process for 26, 27, and just thinking about the committee's schedule, because I know one of the things that we talked about in the debrief was just wanting to make sure we were on top of the process, and we had a different process than last year. So whether this group is more, is able to implement, what the lessons learned from last year and that timing of how things work. I just want to put a flag on that, that we need to make sure we leave time in the schedule for all of that to actually happen.
Yes, ma'am. And
Yeah.
completely agree with you. This was our very first RFP after 3 years of funding with the opioid settlement. And so I don't know, or I haven't spoken with anyone in regards to the frequency of RFPs. I don't think that we were actually planning on doing a yearly RFP. So I would have to definitely touch base with you in that regard. But once again, I have to touch back with our budget team so I can make sure I have accurate understanding around what spending looks like. But from their last advice and suggestions was that we will be reverting back to our, typical annualized spending, which is around that 1.2, 1.3. But just so for awareness for everyone, we do our budgets, like you said, typically every December and also January. At the end of January, we typically are closing out actually our budget process early into February. For department side of things, county budget, they have those rest of those months to really work and squeeze everything else out. So typically, so if you want to mark that in the calendar, January is the typical month where we have a lot of different budget requests that are happening across the county. Not anything beyond February is really outside of that window.
Yeah. So Jason, would you be able to hopefully provide us with a update about that at the next meeting?
Honestly, I really can't guarantee when I can
Okay,
provide an update for that. Like I said, we're still closing out last fiscal year. We are
okay,
trying to get things ready for FY 27 as we're still processing contracts and things like that still. So yeah. So
okay,
yeah. It might be a few months, and like I said, I'll keep reaching out to county budget, and as soon as there is an update, I will make sure that we deliver that update.
okay. Thank you.
I think in addition to that, just to flag that I know that the conversation has been started with the commissioners about what the role of this committee is in the recommendation process. And I think that having some clarity on that, in addition to like a timeline and whether or not there's going to be an RFP, could help with planning as well.
Yeah, I agree. Agree. So we've adjusted now our calendar. So we do have a little bit more time to figure out the process for the grantee presentations, but I think it'll be good for us to go ahead and start that tonight. So I just wanted to share again, here are the questions for the guest speakers that we've already identified. We'll come up with a list specifically for the folks who are from other communities. And that'll be happening after this meeting, but I just wanted just to share again these questions for the guest speakers. And then the list of grantees, as Jason was saying, there's several. So that's also part of our thought, like our thought process tonight. How do we want to, order the presentations? Is this a two meeting process? Is it a one meeting process? I mean, how are we going to make sure that we have enough time to dedicate to each organization to learn about what they've been doing, what have they been learning, what have they been hearing from participants, community partners, and then also what are the questions that we want to know? Like what do we want to learn from them? Specific questions or information. And again, yeah, the consideration, like the order of presentations, is this a two meeting process? So that's what we're going to work on now for about the next 20 minutes or so. Um, I'm going to go back to a Word document because also we want to think about how can we use this opportunity of learning from the grantees to fill in information about some of the different steps within our collaborative strategic planning process. So I want to also just share some of those steps. Um, Brittany shared with us the models, measures from OSTAT, from North Carolina, from the North Carolina OSTAT group that has like the different measures, including process measures, outcome measures for each of the different strategies. So again, this is just our figuring out, what do we want to learn from the grantees? What questions do we want to share with them ahead of time so they can come prepared? And how do we want to organize, knowing that we have several groups here in Durham, and we want to make sure that each one has an equal amount of time to spend with us. Um, so what questions do y'all have for the presentations?
I think something that could be useful to hear from folks, certainly not like spend an entire presentation on, but just like at the very beginning, just kind of recap like here's what we planned to do with these funds, and here's what is actually going to be feasible to do with these funds, because I think we all know that that changes all the time for so many different reasons.
Yeah, and when it's feasible. Okay, yeah. I'm going to ask you, Jamie, because you did bring up the point that, at this point in the fall, headed into, the holiday season, that they've had like maybe what, 3 to maybe 5 months. So are there some early stage questions that you're thinking about would be interesting or important for us to hear from them?
Yeah, it's a good question. I mean, I think, yeah, when I had thought we've been thinking this through earlier, I was sort of imagining that it was going to be, well, this is sort of the end of the year cycle. They've had a chance to kind of really implement the work, and they're going to be telling us about, these are the outcomes. This is, maybe we referred this many people to treatment and they were retained in care for 6 months. This is the percent, things like that, some of the outcomes on that outcome document that you sent. But I feel like a lot of those are not going to be relevant yet. Like it's just going to be too early.
Mhm.
Yeah, I mean, I guess I think like what our goals from these presentations are kind of does depend a lot on like what is happening with next year. In like, because I think if there's going to be a new RFP and there's going to be the opportunity to potentially fund different programs that weren't funded this time around, like then we may want to hear more from kind of the community at large in those sort of listening sessions that we identified rather than spending a lot of time with each individual currently funded program, just because that might be kind of, well, our blinders are just on the currently funded programs. But if we know that, or like if we know fairly soon, there's not going to be a new RFP, there's maybe going to be the decision to uh, extend the funding for another second year or something for most of the programs, but it sounds like potentially like we won't have as much funding next year. So maybe our decision is actually going to be what of the current funded programs are we going to cut, or are going to be not are we going to cut, but are going to potentially not be recommended for funding if the constraints of the budget are that way.
Mhm.
Then then I don't know. I mean, I think like we're having to make that decision on a really short time frame without really being able to know about outcomes and things over very much time. I do think that makes it tough. Um, so yeah, I don't know if I have any
Mhm.
great questions to add at this point. I'm just trying to think about yeah, kind of an overview of like what's been able to be done so far. I mean, I think like we would be impressed by by people who've been able to get things moving and get the ball rolling already. So kind of like what's already been implemented, what's yet to be implemented, and like what and how I mean, and like what sort of kind of process and or kind of better outcomes in terms of things that we care about, like retention and care. I think, like
Mhm.
what kind of things like that, like what can you go ahead and report on at this point, knowing that it's quite early. Or I mean, I do think the other thing I think is just like the not kind of this a sense of sort of the scale of the work. I think some of our RFP applications were, they sounded like a really great program, but then they were trying to reach 10 or 20 people for the whole year, And so I think like if a program has been able to already start to engage a lot of people, on a short time frame, then like maybe we don't know, well, what's the long-term outcome of that engagement yet because they haven't had time to really follow through on
Mhm.
making changes, but like what numbers have you been able to start, I guess,
Mhm.
engaging? Yeah,
Yep.
those are just some thoughts offhand.
Yeah. Anyone else? I have one question I'm thinking of, but anyone else want to go ahead? Go ahead, Dawn.
So based on what Jamie is saying, which I think makes sense, it really wouldn't have been a whole lot of time
Mm-hmm.
to see what these groups that we funded have actually accomplished and be able to measure that. So I'm wondering if, as you mentioned earlier, do we want a one meeting or two meeting? I think it, how do you guys feel about if we do two, where the first one is kind of what um I think Jamie was saying, where they tell us what they have, what their plans are with the funding they've got and what they have started or implemented so far to achieve those plans. And then the second one later when there's probably a good enough time, but certainly before it's time for refunding to see what they've done. Quite frankly, I would like to see from these groups if they could tell us what they were accomplishing before they got these extra funds, and then after they got these funds, what impact did it have in terms of increasing what their goals were in terms of dealing with this opioid crisis. That's what I would like to see,
Mm-hmm.
quite frankly, or
Yep.
hear about.
Okay.
Yeah, it would be good to know if we would be able to hear from, if we're going to hear from groups this early, like November, and then Jason said the budget process starts kind of in January, but I don't think we finalized our recommendations until pretty late in the spring. So like if we're going to be on a similar, I don't know if we would be on a similar time frame for next year in terms of when like those recommendations would be expected from us. But yeah, being able to hear from groups further out in the spring, when they could really tell us a little bit more would be useful, like Don said.
Yep. And then maybe spring of 2027. And I was thinking back to some of the proposals, like they proposed that, they have to hire new staff. So that could be something like what have you done so far? So hiring new staff, if that was something that you had in your proposal, things like that. Um, and so yeah, I'm also liking this two meeting format as well. So maybe one in November and one in the spring. So um November can be the initial, this is what's happened so far, is what we've done. Um, I like the idea of like, what you plan to do and what is feasible. I think maybe at that point, speaking as like from a small community-based organization, that's kind of the point where you're starting to think about what is feasible. But I definitely like this question. I'm not sure if they'll be able to answer that second part on what is feasible, but definitely like the plan of what you to do with the funding. Um, So maybe these are kind of the initial questions for this November these November presentations. Just what have you done up to this point? Do you have any info about early numbers? If you do, please share them. And that includes like how many people have you reached so far? And have you done things like hired new staff if that was something that you had proposed in your application? Go ahead, Commissioner Jacobs.
Yeah, I want to follow up on a few things. One is I think Jason kind of did a reality set that reminding us that we did go above the allotted. We did get extra funding this year, and most likely the coming year is going to be going back to, I guess, $1.2 million. So I think that is, and we're under really overall the county is going to be under a lot of budget challenges with things like related to HR1 and expenses related to that are coming down to us around SNAP and things like that. So I think we are going to be in a constrained budget situation going forward. So yeah, I think these conversations are going to be important. I'm wondering what what role those really great measures that you sent out with the agenda, Shalisa, that are from the state, opioid settlement measures, the performance measures that were very, really detailed. And I'm wondering, Jason, how do those measures and data get incorporated into the actual contracts that we are doing with all of the everyone who's being funded? Could you just I think that will help me at least with in terms of this question of what do we want to ask. How did those measures from the state get incorporated into our contracts?
Yeah, so every funded organization that we execute a contract with, and this is for every county in North Carolina. Each funded organization has to choose one metric per under the three measures. The three measures are process, quality, and outcome measures. Process is how much did you do? Quality is how well did you do it? Outcome measures is going to be how well off is anyone from these your the strategies. Under each one of those outcomes, like I said, there are different metrics, which is on the metrics model that you guys already that was already set by the state. They are to pick, at least one. We recommend obviously as much data as possible, but we don't want to constrain any organization by asking them to do more. So we ask them to do at least 1 to 2. During our orientations that we do, we ask them what data are they already collecting, and so from this list that is required for them to report out on, and then that each organization will typically pick out a measure in alignment with those measures there, and then that then goes into the contract.
Okay,
And so
that's really
therefore, yeah, so that's
that's
essentially how that works out, and how that goes. So their contract, their scope of work is going to be based off of, their capacity, what they're able to do, but it has to be based off of one of those process, quality, or outcome measures. So each one is going to pick, even if it's in the lock zone, that organization might, they might pick a different process or different quality or different outcome measure. And so that's where the complexity essentially comes from. But from our population health team and myself, that's where we kind of compile all this data all together to kind of bring one comprehensive look at what's happening across the settlement dollars as a whole. So hopefully that answers your question, Commissioner Jacobs.
well, that's really helpful because I mean, one approach that we could use is ask each of the groups who's presenting, well, each recipient to just give a brief update on how is, based on the measurements that they've chosen to use, how's the process going? How's the quality? How's the quality going? How are your outcomes going? Like just, what letting them explaining what measures are they using and like how are things going? And I'd just be curious to hear in general, like, what are you seeing as successes? What are you seeing as challenges? Because I think one thing that would be really helpful for us, like one thing that I think is really helpful about hearing from all these groups, is like what is really happening on the ground in our community, especially around challenges like all of these recipients, they're the ones who are working with people who are suffering from opioid addiction. And I think it's important for us to understand like what is actually happening in our community, and what's working well, but like what are some really hard things to address. And that might help us when we think about what are things that we're not funding now,
Yeah.
or what are the priorities. So anyway.
Yeah. And Jason, I just wanted to ask, so they choose just one measure within each category or just one measure, period?
Yeah, I'm sorry, I had to get ready to head off to another meeting, but
Uh-huh.
there's three measures. There's a process measure, a
Uh-huh.
quality measure, and an outcome measure.
Mm-hmm.
More than that, it should be on even the measures model. If not, I can share with you the template. And under
Uh-huh.
that measure, there are metrics
Uh-huh.
or activities, and they have to pick at least. Well, they have to do all the measures, but they have to do at least one metric underneath of each measure.
Okay.
And yeah, hopefully is that clear, Jaleesa?
Yes.
Okay, awesome. All right.
Got it. So we could ask this question. Um, and I like I also the successes and the challenges and what are they hearing from community participants as well. Go ahead, Jamie.
Yeah, I guess another thought, just since it sounds like we likely will have less funding for the upcoming year and maybe won't be doing a new RFP, but we'll just be kind of like looking at the current programs and whether we, to what extent we can extend their funding would be like, hopefully this will be an ongoing process, but like, are you looking at sustainability of your program and like what other opportunities for funding do you anticipate being able to access in the future? Because we know that like this funding that we have pool gets smaller and smaller over every year. And so like we're not going to be able to just the funding is not going to be available to continually fund everything that's currently being funded, it sounds like. And so like maybe, the answer to that I know is really hard. I think the answer to that in the RFP applications was generally
Mhm.
really hard and kind of vague. But like, if anyone really is able to say, oh, we actually know that this program next year is going to fund this much naloxone or, something like that. Like, I think that would really help us to know that these programs are being proactive with thinking about that, thinking about the future.
Yep, yep. So given that there's several grantees, and we're talking about the first meeting or the first, the first learning meeting being in November and then a second one in spring, how do y'all want to format the meeting? How much time should each group get? Um, what are your thoughts about that? To make sure again that we're giving everyone an equitable amount of time to share and respond to these questions. Would 10 minutes, 15 minutes be enough per presentation?
I wonder if we gave folks 10 minutes and then we had 5 for follow-up questions.
Okay.
And then if we need to, I mean, that's a considerable amount of time. It might like look the way that it did in April, where we might need to have like multiple meetings in a month to
Yeah, we might need to have a second
accommodate
meeting.
folks.
Yeah, I agree. 10 minutes for presentation, 5 for Q&A. A lot of y'all have your cameras off, so I can't tell if y'all are shaking your heads, smiling or frowning or,
Sounds good.
yeah, okay. So we have a set of questions. We will get them in better shape, of course, before they're shared with the groups we want to invite. We're proposing 10 minutes for their presentations and then 5 for Q&A for everyone. And then we're also proposing to have a 2 meeting format, one in November, which is just about what's been happening since July, and then invite them back in the spring to just give updates. And that time we focus on, impact, how they've increased capacity, services, that sort of thing. So we'll come up with a new set of questions around that time. Anything else we need to think about for this November meeting? Okay. All right. So I think we're getting close to the end of our meeting now. We need to think about agenda items for September. We want to invite um, Durham Joins Together to share with us their work. Other agenda items for the committee's discussion for September. Any other information or announcements anyone wants to share before we end tonight's meeting?
Yeah, Shalisa, Shalisa and I have discussed this, but this was my last meeting as a member of this committee. I will be saying goodbye. And yeah, I wish everyone well in the process for this upcoming year. Um, and thanks for, everybody's like shared passion for making sure that these funds are well stewarded.
Thank you, Brittany. Go ahead, Commissioner Jacobs. Yeah.
Well, I'm sorry to hear we're losing you, Brittany. Thank you so much for being a great co-chair with Shalisa. And sorry to hear you're leaving us. And thank you for everything, especially helping us get through last spring. And that means we're going to need to find someone else to work with usually. So,
Yeah. Yeah. Shalisa's great to work with.
yeah,
This is
you
this is
can't leave, and you
you.
can't
Yeah.
leave, Lisa.
Yeah, Paul.
Paul?
Well, yeah, I want to echo that. Brittany, here you are. You just got through all the really hard stuff, and we're going to be coasting really easy and clear from now on. And anyway, we're going to miss you. Your contribution has just been immense. So anyway, just thank you so much, and of course, wishing you all the best.
Thank you. Thanks, y'all.
Thank you. And
Really
it's been
appreciate it.
so wonderful to work with you, Brittany, and to get
Such
to know you
bless
as well as
you.
a person. Yes.
Yeah, it's been great. Yeah, so I hope folks will keep in touch if you want to.
Yeah.
I'm still around.
Absolutely.
Thank you for everything, Brittany. Appreciate your leadership.
Thank you.
Yeah. So, now that we've gotten to the end of our meeting, can we have someone make a motion to adjourn?
I'll move to adjourn.
Okay, a second. I'll second. All right, everyone. Be back in touch soon. See you all in September. Thank you so much. Bye-bye.
Lisa.